Okay, so right on 11 o'clock now, so I'm going to get started. So welcome everyone. So I'm Lucy Caldwell and I'm a registered nurse. I work for Care Beans. I've met a lot of you before, I think, on these sessions. I recognise some names, so nice to see you all again. And for any new people, I'm the nurse at Care Beans. So I provide these webinars last Tuesday and Thursday of every month. You can register for those on the website. And yeah, we're going to be looking at mobility today, and we're going to be looking at what sort of care plans we've got in place on the system. So if you're a customer, great, I can show you sort of around the system, familiarise yourself with all the care plans. If you're not a customer, that's fine, it's all still relevant. We're talking about care planning and mobility. If anyone did want a demo, then please feel free to get in contact, and I'm more than happy to give anyone a demo of the system. Okay, I'm just going to stop my video for now. Hopefully you can still hear me and we will get going. Okay. So today we're looking at mobility and supporting service users. So this sort of goes across the board really. You know, it is relevant for people in the sort of residential setting, sort of mainly focused on older people, but it's the residential setting and also within the person's home as well. You can also care plan for those as well. So we're sort of looking at everyone really. So we will be covering today the causes of reduced mobility. We'll be looking at the environment, we'll be looking at falls risks, and then, you know, essentially we'll be looking at the care planning and sort of suggested functions and actions that you can put in place just to make sure that you that everyone's aware if anyone has got reduced mobility and how we should be supporting them. So mobility is the ability to move or walk freely and easily. So of course, anyone with reduced mobility for whatever reason, it's, you know, that's of course the inability to move or walk freely and easily. If we look at the causes of reduced mobility, many different causes. Sometimes there's multiple causes, of course. So illness. So people might have certain conditions such as motor neurone disease, for example, or multiple sclerosis. Some people may have had a stroke that can often cause left-sided weakness. So there's all sorts of sort of illnesses that can cause reduced mobility that might be ongoing or might be temporary illnesses. And then of course treatments for illnesses, for example, surgery, that might be a cause of reduced mobility. Again, long-term or short-term, we're sort of looking at both scenarios really. People may suffer from weakness and fatigue. Again, that could be due to illness or sort of medications they're on. Gait, or so the ability to balance themselves. There might potentially be any abnormalities in people's balance that may affect their mobility. There might be people that are breathless. That could be caused by a variety of reasons. Could be due to long-term conditions. For example, things like COPD, so chronic obstructive pulmonary disorder, that can affect breathing and cause breathlessness. That can in turn reduce somebody's mobility. And then, of course, you know, pain and things can cause breathlessness and, you know, reduce someone's mobility too. People that become confused quite easily, so those with dementia, for example, they may have cognition difficulties, so that can affect their ability to mobilise well. People might be fearful or anxious about falling over, so that can therefore reduce their mobility because they feel nervous about sort of moving around or attempting to mobilise. And then being connected to equipment can affect people's ability to mobilise well. So things like syringe drivers that people might be on, or drips, for example, fluids, or oxygen if they're attached to oxygen masks and things. And of course, that can reduce their mobility. And if a person experiences a sudden reduction in their mobility, then, you know, it's always advisable to seek medical help. So, you know, GP or 111 or 999. If it's a sudden reduction in mobility, that needs to you need to get sort of medical assistance for that. Okay. I'm just going to make sure that everyone is muted. If I can just ask everyone to stay muted unless they have a query, but also feel free to put stuff in the chat because I'll periodically look at the chat questions, but we can also have a little session at the end as well where we can look at Eyesight could, yep. So John's asking if reduced mobility could also eyesight be a factor too. Yes, absolutely. Um, so if people can't see well, if they've got impaired eyesight, then yes, that can affect their ability to sort of move around and therefore sort of reducing mobilization if they can't sort of see well. So yes, absolutely. Um, yeah, impaired vision. Okay. So, being less mobile, obviously, that can be very frustrating, especially if someone's used to being very active. If it's a sudden thing or a deterioration in health, it can be very frustrating. It can have an impact on someone's quality of life, of course, if they become less able to do things that they're used to doing. Um, some people can experience additional physical and emotional problems as well as a result of being less active. And some people who are less active and have a reduction in their mobility may also experience, as a result of their reduced mobility, weight gain, for example. So that's, due to lack of physical activity, meaning they're, gaining more weight, which can be detrimental to health, of course. So loss of appetite as well, possibly weight loss. People may get constipated if they're not moving well. It's not sort of getting things going. So people may experience constipation. They may also experience buildup of fluids. So, for example, people with congestive heart failure, for example, um, they may experience fluid buildup, especially in places like the feet or the legs. And then that can be very uncomfortable. It can also be painful, but that can affect someone's ability to move around as they would have done. People can experience skin sensitivity or pressure areas as well, as we know, due to reduced mobility, sitting or sort of lying in the same position for too long, for long periods of time. They may experience sort of pressure areas if they're not able to sort of move themselves well. So it's just important to be mindful of that, and keep an eye on people's sensitive areas that, could be prone to sort of pressure ulcers. Some people may experience loss of muscle strength if they're not mobilizing well, so they're not then exercising well. Their muscles can become weak, which can then mean that activities become more difficult, for example, or more tiring. And then also people with reduced mobility may experience low mood or anxiety as a result of that. So being less mobile, it means that people may need additional help with activities such as washing and dressing. So it's important to be mindful of those things when we're doing people's care plans. It can be a difficult adjustment for many people if they do have reduced mobility. Um, Changes in mobility, of course, are common as we get older due to the sort of variety of things that we've looked at before. But there's lots of things that we can do to support people to stay as independent as possible, because, of course, that's the key thing, is what we want to do when we're supporting our service users is to help them maintain as much independence as we possibly can. We may not be able to eradicate the reasons for the reduced mobility, but we can do as much as we can to promote independence, as much as possible. So if we are concerned about someone, we can speak to their doctor or nurse, for example, if they're having problems with mobility, because specific problems may be able to be addressed that are affecting mobility, which we can then incorporate into our care plan for that particular person. So there might be referrals that you could make to particular services, so other health and social care professionals who might be able to help. A few of those examples I've got down here on this particular slide. So health and social care professionals that may be able to help, that were very useful in offering support and guidance for people with reduced mobility, are people such as occupational therapists. So their role is to assess if any equipment or adaptations to the home, the person's own home or the residential home, may be available to help the person stay as active as possible. There's lots of different mobility aids that are available. There could be things like grab rails for doors or bathrooms, for example. The person may benefit from having access to a wheelchair, walking frames, things like stair lifts, and adaptations to the home like wider door frames and ramps can also be assessed for too by the occupational therapist. Quick look at questions. Oh, that's okay, Nick. You're late. Don't worry, Nick. That's fine. I'm glad you were able to make it. I know you said you're having a few issues, weren't you? So I'm glad to see you've made it, Nick. So we're just looking at health and social care professionals that you might be able to refer people to if they have reduced mobility. So physiotherapists as well. They can show the person exercises, for example, to do to keep active. They can recommend those mobility aids that the occupational therapist might be able to provide, again, such as walking sticks, wheelchairs, and also show them how to use those properly so that they get the full benefit from those different aids that are available. Quick look at the chat there. Lovely. Okay. Social workers too, they can help people organise getting equipment or adaptations to the home. They might also be able to help access sort of financial help, for example. Social worker might be the good person to refer them to if someone might need financial help in getting access to particular pieces of equipment. And as we said, it might not be possible to get back to the level of mobility that they had before. But these people are there to help them adjust so that they can be as independent as possible, because of course that's where we want to be, really, or that's where that person wants to be. So assistance from these people can help them make the most of their energy and help keep them safe. Okay, and then we've got complementary therapists on there. So there might be people that so for example massages, people that can do offer complementary therapies, massages for aching muscles, that type of thing can also be beneficial for those with reduced mobility. There's lots of different people we can refer to get professional advice to help us with our support that we can offer people and to help us with our planning of care for those people with reduced mobility. So if we just look at, let's go to the next slide. So if we look at the environment, so this can be the environment, like we say, in the person's own home or in the residential setting. So we need to think about the following things really when we're looking at the environment that the person is living in. So different rooms in the home. I'm just going to pop you on mute there. I can hear some background noise. So I'm just going to mute everybody. There we go. Okay, so different rooms in the home. So yes, it's just about keeping the different rooms in the home clear of equipment and things so that people can move around nice and easily. It's being mindful of what we can provide in different rooms in the home. So as well, in residential settings, looking at communal areas too, like the communal lounge and what have you. Stairs, you can think about stairs in terms of potentially putting in stair lifts for people or a banister, something that's easy to see and easy to use for those that may have trouble going up and coming down the stairs. We need to think about entries and exits to environments, so to make sure that they're easily accessible for those with reduced mobility or for those that are using particular aids or, for example, a wheelchair, making sure that entries and exits are sort of clearly marked and, wide enough and easily accessible really for those with mobility issues. It's also useful to think about outside spaces. So again, making outside spaces easily accessible for those with reduced mobility. So for example, wheelchairs again. So it's thinking about things like level pathways. It's thinking about making sure that outside is well signposted so people can sort of, know sort of how to navigate the outside spaces. And again, it's about promoting people to be able to go out to these outside spaces and not cutting it off to them because they can't mobilise well. So it's about opening these spaces up, making them easily accessible for anyone with issues with their mobility. Lighting is also really important as well. So just making sure that places are well lit, either with natural lights, that's often the best light, but also artificial light as well. So dark areas, you need to make sure, corridors and things, you need to make sure that they're very well lit so that people with reduced mobility can easily sort of navigate those areas. Sometimes you can get sensor lights as well. So, rather than keeping the lights on all the time in the corridors, for example, you could consider sensor lighting so that when somebody does enter that space, whether it be a corridor or a bathroom or their own room. But consider when they are entering those spaces that they're well lit, and sensors might be a good idea for ensuring that that happens when anyone enters that area. And then also equipment, so thinking about things in the environment, such as grab rails, such as hoists, those things, pieces of equipment that people may need that are accessible to them basically in the environments that they're living in. Okay. Just continuing with the environment. Clutter, of course, we need to make sure that places are clutter-free as much as we possibly can do in the environment, just making sure that there's as much clutter-free areas as possible. We need to think about the positioning of furniture so that furniture is easy to access, and also so that furniture is not in the way when people are trying to navigate their way around the environment that they're living in. We can consider as well heights of furniture. So furniture that's easy to sit and stand from, that's easy to access for people. Floor surfaces as well. So floors may be slippy if they're highly polished or if they're wet from cleaning. So that's something to be mindful of if you do sort of clean your floor surfaces. It's just to make sure that they're not slippy and wet for people that may have difficulty mobilising or are prone to falling. Just making sure that it's either well signposted that those areas are wet, or it's just ensuring that they sort of aren't wet after they've been cleaned. And of course, making sure carpets are all fitted correctly within that environment. There's no sort of upturned carpet or that type of thing. And then walking aids. So again, as we said before, making sure they're easily available to encourage people to mobilise around their environment. We don't want people just sitting in chairs thinking that they can't mobilise because they haven't got accessible areas. And obviously, anything that needs repairing, it's important to report any hazards. So things that might need repairing, we're wanting to minimise risks, we're wanting to promote independence. If we just think about those things as our key goals, to minimise the risks for people, but also to promote as much independence as possible in the environment that they live in. So if we're looking at falls, so there's lots of information on falls, in particular NICE guidance. So if you go onto the NICE website, so that's NICE, NICE guidance. If you go onto the website for NICE guidance, there's lots of information about falls. If you just put it into the search engine, there's lots of useful information that we need to be mindful of when we're looking at sort of falls policies in the home and that type of thing. There's a particular piece of guidance called Falls Assessment and Prevention of Falls in Older People. There's lots of information on slips, trips and falls as well on the NICE website. So NICE have reported that people aged 65 and older have the highest risk of falling, with 30% of people older than 65 and 50% of people older than 80 falling at least once a year. So that is NICE statistics that they've sort of put in place there. So that's just something to be mindful of as well. So there's lots of guidance that we need to adhere to when we're looking at policies for slips, trips and falls and how to prevent those. The Care Quality Commission as well, if you're in England, and the other inspectorates as well, they also provide guidance for service providers and managers on slips, trips and falls. So again, if you access their website, I've taken some information from that NICE guidance, but if you access CQC website, they do provide a lot of information on falls or preventing falls. So NICE guidance, that is a recommendation. So the NICE guidelines are recommendations, and that's obviously evidence that's been carefully considered by NICE. It's been formulated into some guidance, and it's something that we need to adhere to when we're looking at our policies, as we've said. And they need to be taken into account, these NICE guidelines. One of the things that they do recommend is a multifactorial assessment, so a falls assessment. So Basically, a multifactorial assessment is an assessment that identifies certain risk factors, so different areas. So it identifies risk factors for falls, and it identifies things that can be treated or improved or managed. Okay, we may not be able to get rid of all the factors, but we can take them into consideration and look at how we want to improve and manage people's mobility and reduce the risk of falling. And that's what we want to include in our care plans as well. We do have an assessment that includes different factors on it for falls, and I'll show you that when we go onto the system shortly. But there's a couple of those things might include, so those factors include cognitive impairment. So people with a cognitive impairment, so for example, dementia or a learning disability, for example, or something that impairs their cognition, that might mean that they can't follow direction, or it might mean that their reactions are slower. So therefore, they're naturally at more risk of falling if they have slower reactions, or if they can't sort of follow direction. Lots of people, older people, may have continence problems. So the urgency to go to the loo, for example. So if someone has got the urgency to go to the loo and they have reduced mobility, if they're rushing, then of course that can increase the risk of falling. So that's really important to be mindful of that and to include that in your care planning as to how you're going to support that person with any continence issues. It's also important in the falls assessment to look at falls history. So to look at why they've fallen, or well, how many falls they may have had in the past and what the reasons were for that. And we can factor that into our care planning as well. Footwear is another factor. Some people might have footwear that's unsuitable. They might have footwear slippers that are sort of, quite big and loose. They don't do up very well, and can cause sort of trip hazards. And then also health problems. So conditions that we looked at earlier, they may increase the risk of falls as well. Medication. So there's certain medications that increase the risk of falls. They may be medications that cause drowsiness, for example. Someone mentioned before, I think it was John mentioned impaired vision. So someone may have impaired vision. They may also have medication that causes impaired vision. So that can, of course, increase the risk of falls. There's also medications that increase the urgency to urinate. So diuretics, for example, or water tablets, things like frusemide and that type of thing that promote urination. That can often cause them an urgency to urinate. So therefore, there'd be an urgency perhaps to go to the toilet, which might increase the risk of falling. So balance and gait, we sort of looked at that earlier as well. That's another factor when we're looking at risk assessment. So if someone's imbalanced or has a poor gait, that can cause sort of a postural, instability. It can cause mobility problems, balance problems, and therefore increase the risk of falling. Syncope syndrome. So syncope is fainting. It's a medical term for fainting. So if people are prone to fainting or passing out, as we might know it as, then of course that can cause people to fall as well. So it's just to be mindful if people do experience fainting episodes. And obviously, if that's a new thing that they're experiencing, fainting, then you need to sort of get some help about that, medical help. But that is something that some people are more prone to, fainting. And of course, that would cause a fall. And then visual impairment, as we said before. So anyone with visual impairment, that increases the risk of falling too. So what we're going to do now, we're actually going to go onto the system. I was going to see if anyone's put any questions in the chat. There's no questions so far. So we're going to go onto the system. And now we've looked at sort of the reasons of falling, what causes reduced mobility, how we want to put plans in place to promote their independence. We're going to go onto the system and we're going to show you what we have on the system currently in terms of moving and handling assessments and falls assessments and alerts that we can put in place and care plans that we can put in place as well. So we're going to go on now to my system. Here we go. So we're on Care Beans Lodge. So this is my demo site now. We're going to look at Sally Webb, our usual lady that we use for these webinars. So Sally Webb, we're going to go onto her care plan page. I'm just going to have a look and see what we've put in place for her. Now, before I go on to this, just to reiterate to you, for those that haven't been on the webinars before, what we're going to do after this webinar is we'll send out a link to you to your email. I think there was some problems, so I apologise for that. Last month there was some problems with the mouth care assessment link, but we've got that sorted now. So what will happen is you'll get a link sent to your email address, and that will give you access to this recording. This recording will also be on our YouTube channel, which is on the website. You'll also get a CPD certificate to say you've attended this session this morning, and you'll also get access to a resource pack. So basically what I'm going to show you now, the care plans and the assessments and what have you, there's a resource pack that you will get access to, which will show you the examples of what I've put in the care plan. So just to be mindful that these are examples for one particular person. Everybody is different, and we need to be mindful that we're putting appropriate support in place for that particular individual. So this is just one person that I've done an example for, which you will get. But obviously everybody's different and need to be have their care planned appropriately. So let's go into Sally. I'll show you what we've got in place for her. So I'm going to go into her care plan page. So for those on the session who aren't customers, this is what we call her main care plan page, where there's a variety of care plans that are in place for this particular person. And we have put the care plans in place that we need. We're going to look at the Falls care plan and the mobility. All the care plans are the same templates. It's sort of got what the issues are for that area, what their goal is, and how we're going to support them. That's what each care plan is, each care plan's template looks like. Okay, that's what we're going to look at now. But prior to that, so I just want to go back up to the top here, because we've also got a little falls alert. So we've got a robust care plan in place down here, but we've also put a falls alert. So we've already ascertained that she is at risk of falling, Sally. So we've put this little alert in place. And this piece of information follows her around on the main system. So wherever we see her details, we see these alerts. It will also show up on the app. So the app that the carers and the support workers use on a day-to-day basis when they're writing their reports. They will also see these little alerts at the top, as well as having access to the care plans that they can read in full. But they've got these little alerts as well. So you can just tap onto them and you can see information behind there that you've put on. So if I just tap onto this, I've put some information here that she's at risk of falls. She needs close monitoring and support, and we need to record it on an incident form if she does have a fall. We're going to put as much support in place as we can to reduce that risk. So we'll just close that for now. And I'm going to just show you how we put that falls alert in place for those customers that are on the webinar today that do use the system. So for those that may or may not know, if you go into conditions and alerts, you've got kind of an overview of their alerts in place. This is all of them on the left here. So there we go. I've said yes to that particular alert, and I've put some background information in there, and I would save that. So in doing that, that's how I've put that particular alert in place that follows around the system. Okay. Then if we go down to the care plans, we'll have a look and we'll see what we've got in place for that. So first of all, there's a whole range of assessments that are, you can put in place for people. So assessments, they could be scoring tools, they could be just a range of questions and answers about particular different areas. And what we do is we pick the appropriate assessment and we can link it into our care plans. So for example, I've put lots of things in place for Sally here, but she's got a falls tool and I've linked that into her falls assessment, falls care plan. So when I go to do a falls care plan, I've got a falls tool there ready to be filled in. For mobility, I've got her moving and handling as well, We've actually, that used to be called manual handling. We've changed it to moving and handling. We've got some rogue S's in there, which we're going to get taken out. So if you've noticed those on your system, they will get taken out, those rogue S's there. But we've got a couple of assessments. We've linked them into our care plans, and this is what it looks like. So if we just have a look at the mobility one first. So if I tap into that, this is already done for Sally. So as with all the other care plans, we've got these different areas. So we've got our sort of review section here. We've also got in the review a summary of care. So I've put a summary of care here. This is what would go through to the hospital transfer form. So I've got my robust care plan down here, but I've also got a summary of care up here. And this summary would go through to a hospital transfer record. So if Sally does go into hospital, I can pull off a hospital transfer record, which I can give to the paramedics or whomever it may be. At least I can take that information in with Sally to hospital. We can also keep a copy for ourselves. But this is the piece of information that goes through. So rather than the whole big care plan, we're putting a summary that we would like the hospital to be aware of when they admit her into the hospital. So that's what that summary is there. And then as we go down here, we've got her assessment in place. So what I've done here, just going to leave that for now because we've put that somewhere else. Oh, actually, I think we've not put, I think I might have had our falls plan removed from there. Okay, that's fine. What we'll do is we'll conduct a review. I'll put it in place. Oh, actually, no, we're on the mobility, aren't we? Sorry, I suddenly thought for a minute we're on the falls. And no, we're not. No, that's correct. So let me just show you what's in place for that. So we've got her moving and handling form here. So yeah, sorry about that. I was thinking we were on the falls care plan then. So we're on the mobility care plan. We've put in place a moving and handling assessment. So this is what it looks like here. So we've got weight, height, and build up here. So we're getting a bit of an outline of what she what her weight is and what her height is and the sort of build of Sally. And then we answer yes to any of these questions and we can put appropriate information in place. So it's got a drop-down list as well. So we can look at, has she got any physical conditions that might affect her mobility? So we pick the appropriate ones. We can pick multiple factors and we can put comments in at the bottom. Cognition difficulties that may affect mobility. We can pick multiple statements and put comments in. And then we've got psychological conditions, any psychological conditions that may affect her mobility. So we look at the sort of whole picture, really. You can pick the appropriate statements and then put some evidence in there. And then finally, we've got one about environmental conditions that may affect mobility. We've got a whole range of drop-down lists there and then comments. So anything extra we can put in here. So we can put more detail down here. And then there's a range of boxes on different functions. So sitting to standing, what her balance is like. Can she grip with both hands? Can she stand from sitting? What's she like when she walks? Can she climb the steps or the stairs? So there's a whole range of different sort of movements, if you like, that you can put evidence in to see what she's normally like, to build up a picture of her. Okay, so we would fill that in. We'd perhaps do that monthly to make sure we're up to date with that. I've been doing these every so often and I can view all my old moving and handling assessments. So every month I would come and just make sure that's all up to date when I do my care plan review. Okay, so that's the moving and handling assessment that I would put in place for her mobility care plan. And as I say, you'll get this on your resource pack. And then I've put the care plan in place. So what we've put here is those three areas that I discussed earlier. What are the issues with mobility? Got some person-centered information here. So what are the issues? Why can't she mobilise well? So she, for example, Sally's had a stroke. She's got left-sided weakness. She's got reduced mobility. So she struggles a bit to do these particular activities, personal care, getting to the loo, moving around the home in general. She's also got dementia. She finds it hard to follow direction or to understand. So she's fearful of mobilising. So I've put some information in there. What are the issues? We've put some goals in there, where she wants to be, what we're aiming to achieve. So really to be as independent as possible. And then we've got some person-centered details about the support that's required as well. Okay. So that's the mobility care plan. And then if we have a look at the falls care plan, just leave that for a second. We'll now go into the falls care plan that I thought I was in a second ago. If we go into that now, we would see the same sort of template. So it's the same kind of care plan creation there. This time, there we go, we've got the falls tool. So I've filled this one in already. So it's those different factors. Has she fallen in the last 12 months? How many times? Is she dizzy or lightheaded when she gets up from the chair? Does she take more than 4 medications? Because of course they may affect the risk of falling. There's all those different factors that we've said yes or no to, and then we can write comments as well at the bottom. Now this particular one, this particular assessment, whereas the moving and handling didn't give you a score, it was just building up a picture, this does give you a score. So if you save that assessment, you can do a non-committal saving here. Once you fill out your assessment, you can look at what the score would be. You can check all your answers, make sure you're happy with everything, and then you can officially save that and it sits in the table down here. We can always view our old assessments as well. And we can also hover over and see what the risk of falling is by hovering over that score. So then we know, and then we can create the care plan. So these assessments are building up a picture, looking at risk levels, and then we can go into the care plan and we can care plan appropriately. So as I said, we've got what the issues are. So again, she's had this stroke. She's at risk of falling for these particular reasons. She's on multiple medications, for example. Her eyesight's impaired. As John said earlier, that's a risk. She's got dementia. She can sometimes be confused. She's got a high risk of falling. This is what we want to do to keep her. This is a goal we want to achieve to keep her safe. And this is the support that we're going to put in place to help keep her safe. And we're going to do that every month, the falls assessment as part of our big falls care plan review, so that we can keep on top of any changes that may have occurred over the last month, any deterioration in health, any further reduction in mobility. We can constantly be reviewing that and checking that everything's in line and working for that particular person. So as customers that are on the webinar will know, this will go amber just before I need to review it, and it will go red when it needs reviewing if it's gone over. Okay. So if she has a reduction in mobility any time before it's up for review, I can always just go in there and I can review it there and then, as and when needs change. So we're keeping on top of her mobility issues. We're keeping on top of any reductions in mobility, and we're planning appropriately for that. And that is your care planning really for falls and for mobility issues. And as I say, you've got those in your resource pack that you'll get as part of this webinar. So you'll get those sent out to you, so you can sort of have a sort of look at the kind of things I've put in there, where we should be putting what sort of information. So essentially the care plans are what the issues are, what the goals are, and how we're going to support them. And then I just want to see if there's any questions, but I just want to have a look at falls incidents as well. Because if there is a fall, then you need to be able to record that to build up a picture of how often that might be happening. So what we would suggest is to use our incident and accident form. So if you click on to the triangle, you can get onto the incident form. I'll just show you what that looks like. So we would say it was a fall. There you go. So you can click a specific fall as well. And we're doing a piece of work actually on the incident form. So we're going to be doing subcategories as well. So you'll be able to sort of put what the reason for the fall was, if you know, and then you can kind of look a bit more at root cause analysis as to why that person might be falling, if there's a repeated reason that they're falling. So we just create a fall this way. I won't fill one out fully, but I'll just show you the different fields. So we've got where did it happen? You've got all the areas in your home. What happened before, describe the incident and what actions were taken. You can add photographs. So that's not at this stage of injuries. That could be any upturned carpet or that sort of thing. If you've tried to trip over an upturned carpet, or if there's any damage been done, you can sort of click photographs for that. And then you've got what caused the fall. So there's a whole range of different reasons. And as I say, we have these here at the moment, but we're going to be able to do a bit more reporting on this as well to look at root cause analysis. So you've got what caused the fall, It might be that you don't know, because it might be that it was unwitnessed and that you found someone on the floor. So if that's the case, you can just put unknown. It's got unknown in there as an option. Who was involved? So this is where you would put who was involved. So you can start to type the name of the service user, any comments, and this is where you can click onto the body map to add any injuries that that person might have suffered as a result of that fall. Who was informed? Same as before, you can just click that plus button. Put who was informed. If there was a few people informed, you can click that plus button and you can add more people. And who witnessed the incident? It might be that it was no one, as I said, so you can just put in unwitnessed, or it might be that there were witnesses, so you can put the details in there. And again, click that plus button if there was multiple witnesses. And then, because we want to record this in our data, we can tick whether the GP was called, whether we called 999, or whether it resulted in hospitalisation. Might not have resulted in any of those, might have resulted in 2 of those, 3 of those, 1 of those. You just tick the appropriate one and then submit that. So that's how we need to be recording our falls. You can also set up on the general settings, managers or seniors who you might want to receive an email about the fall or a message up here. So you'd get a message up there if you were a senior and you've chosen to have yourself as that person that needs to be alerted. And then we'll just look at reports and incidents and accidents. So we get all of our incidents and accidents on here. We can filter down. So if we wanted to have a look at a bit of a falls diary for our particular person, we can have a look at, we could filter, that's the little filter sign there, and we might just want to filter all of the falls that have happened within this time range here. We might want to look at all the falls for everybody. We might just want to look at all the falls that involved Sally. We've got a couple of falls here, so we're sort of building up a falls diary. And then also on the analysis dashboard as well, you've got some information about your falls here within a certain time range, a date range you can put in here. You could put a different date range if you wanted to, but it will show you all the falls. You might want to have a dig down a bit further and have a look at all the falls that are in the conservatory. So that dashboard data and these little donuts, we call them, would come up. You can see all your stats in here. And you can click on those and have a look at the actual information underneath there. Okay. And so that is the mobility webinar for today. So I hope that's been helpful, and I hope that helps like the customers that are on the system at the moment to sort of make sure, reiterate that you're using it correctly. I hope it's sort of highlighted anywhere that you might have been unsure of, that you now sort of know where you can put certain pieces of information. And as I say, you'll get the resource pack once this webinar has been done. It might be in a couple of days, so just give it a couple of days, but look, keep your eye out for that email and you'll get your link to get your resource pack, to get access to this webinar recording, and of course to get your CPD certificate as well. I'll just have a look and see if we've got any chats on there. No, nothing at the moment, but if you've got any questions or you want me to show you anything on the system, please feel free to do so. Thanks again. Oh, thanks, Nick. That's very kind of you. Thank you. So Nora's asking, how can I have the certificate from last month's webinar? Just send me an email if you haven't had you. Try that link that you got originally, but if that doesn't work, just buzz me an email, buzz me over an email. It's lucy@carebeans.co.uk. Send me an email, just let me know, because I can sort that out for you. Yeah, we had a few problems. Excellent recording keeping. That's good, Carla, thank you. Yeah, good. So hopefully that was helpful to everybody. Yes, sorry we haven't got one this Thursday. It's just the one this month. But if you wanted to join any others, always go onto our website, www.carebeans.co.uk, and have a look and see what's coming up next. And you can always register. That's fine. It's the last Tuesday, last Thursday of every month. Tuesday is 11 o'clock. Thursday is always 2 o'clock. See if there's any more chats. Well, glad you found it interesting. You're welcome, everyone. So Carla, it's your first time here, so kindly advise moving forward. So yes, Carla, if you would like to join the webinars in future, you'll need to go onto the website, so www.carebeans.co.uk. If you go onto that website, click onto webinars, you'll see what's coming up and you can register onto those. So yes, it'd be nice to see you again. You're welcome, Teresia. Nice to see you on here. Good, glad it was helpful. Glad. Oh, that's nice. Elaine, I'm glad you'll be able to use it on your system. Good, that's nice that you'll be able to transfer that information. That's good, because at the end of the day, care planning is care planning, isn't it? As long as we're doing it well, it doesn't really matter what system we're using, does it? As long as we're care planning well. Thanks, Daniela, you too. Email, yeah, Hannah, my email is lucy@carebeans.co.uk. So Lucy at care, Lucy, Lucy at carebeans.co.uk. Shall I write it in there for you? There you go. Ah, thanks everybody. That's very nice messages. Thank you. I'm glad you found it helpful. Oh, Carla's got another question. Go for it, Carla. Shall I put in the, I don't know whether everyone could see that. Let me just put in the chat my let me put to everyone, I think this is. Yeah, Barry, that is good, isn't it? I know that's going to be good, isn't it, Barry? The subcategories for that incident reporting. I know I'm quite excited about that actually. I think that'll be really nice. So Khalil, you're asking about the recorded video that will be sent out as whatever email you registered with to this webinar, that's where it's going to get sent to. So keep your eye out on that and you'll get access to the recording. Okay, so let me just pop my, I think, am I doing this to Nick? Oh, it's lucy@carebeans.co.uk. I hope you've got all that. I hope you've all got this message that I send out now. There we go. Nora, it is a monthly webinar. Yes, go onto the website and you will see you'll see that on there. Will these courses assist working in the UK? Carla, these will they're CPD accredited, so that's continuing professional development. So they won't necessarily they'll build up a portfolio of training for you in terms of continued professional development. I can't really comment about in terms of not being very massively knowledgeable about working in the UK. That wouldn't be for me to answer, I'm afraid. All I can say is that these are CPD registered. Claire's asking, have I heard of postural drop? Yes, when that's when the blood pressure drops, isn't it? When someone stands up. Yes, and of course that could be a risk for falling as well and reduced mobility if someone feels faint. If that's occurred, if they've sort of stood up too quickly, that can be a blood pressure drop, can't it? So yes, that's something to consider. And if someone has got that, has been sort of diagnosed with that, then you need to just pop that in the care plan as well, just so that people are aware when they're helping people to stand up. Okay, I'm glad everyone found it helpful. Dehydrated, yeah, that can cause falls as well. Yeah, there's lots of different factors, and most of those are covered in that falls assessment. Okay, so I'm going to let you go now, everyone. Thanks a lot for joining, and I'll see you next time. Lovely to see you all. I'm going to stop sharing for the moment, and I'm going to end the webinar. I'll just pop my camera on quickly just to say goodbye to you all. So thanks for joining, and see you next time.
Thank you, Lucy.
Thank you. Thanks a lot. Bye, everyone. Have a good rest of your day.
Thank you.
Bye. Bye.
Bye.
Bye.